Good afternoon, everybody. Let's go ahead and get started. I want to welcome everybody today to the webinar, State AT Programs in the Time of the COVID-19 Virus. We appreciate everybody being here. We planned this webinar on Friday. We realized that things were changing from day to day, from minute to minute. There were a lot of challenges, a lot of questions that the state and territory AT programs were facing. And we wanted to give a chance just as soon as we could for folks to be able to address some of those questions and hopefully find out a little bit more about what other states were doing and what the situation was in other states. As far as our agenda for today, what we wanted to do, we wanted to hear first from Ellen Cano from the Washington Assistive Technology Act program. Obviously, Washington is one of the states that was impacted the earliest. And then from Carolyn Phillips with Georgia Tools for Life to talk a little bit in some detail about reuse programs and what the impact is on reuse programs. And then we'll go ahead and share real quickly the questions that have been posed that we had sent out on Friday along with the webinar we've received from states and territories. And then we want to hear what's happening in your states and territories and share your questions and solutions and challenges that you face. And we're going to take questions throughout the webinar in the chat box. And then toward the end, we'll go ahead and talk about those questions when we talk about this section on states and territories. So if you do have questions, go ahead and put them in the chat box and we'll try to organize those. So if there's certain questions with a certain theme, then we can go ahead and unmute that person. And then we're going to provide some resources. ACL has resources, obviously, on the COVID-19 virus, and then we have some AT3 webinar and resources. So I'm going to go ahead and turn it over to Alan.
All right. Hello, everybody. I just have to say, it has been a challenging week. It's hard to believe that we saw each other in just like 10 days ago. Washington, as everybody is, I'm sure, is aware, has had quite a bit more time to deal with this than other states. But I have to say that some of the things that have happened of late kind of came out later than some of the states' responses. So I'm going to start with saying that part of how we're dealing with the situation in Washington is that we don't know how far and wide this virus has spread. There are very limited tests available, very limited testing has been done. So we're treating everybody as, acting as if everybody we meet has been in contact with the virus at some point, and using that as sort of our guidance with how we're providing our services. So that being said, some of the biggest challenges that have happened, and I know this is being faced by some of the other states and territories, is that the K through 12 schools were closed officially starting today. And it's through April 29th currently in Washington State. The challenge with this is that the University of Washington had already asked all staff who could telecommute to do so. And so we started doing that. We implemented that a week ago. And there are still some of my staff who have to come in, but we're doing limited office hours, and I've reassigned some tasks so that they can actually work remotely. But what the K through 12 closure has done is it has created quite a bigger challenge in that 3 of my staff have school-age children who are now at home, and need to be cared for. There's no child care available, very difficult to rely on traditional child care providers such as grandparents because they need to be in social isolation more than the general population. So it's created quite a few challenges. And so sort of what I'm going with my staff is we are looking at curtailing what we have available in person. We already have suspended our device lending program. That is mostly because, as I said, we just don't have an idea of how far this infection has spread in the community. And so to protect both staff and the users of this program, we felt it necessary, at least for until the early April, maybe mid-April, to keep that suspension in place. We are researching some sanitization methods that we've not used previously, such as UV light, and using sunlight as well to help sterilize equipment. But again, you know, since we don't know the spread of the virus in the community, it's out of an abundance of caution we've suspended that program. We are offering our device demonstrations and some of our in-person training that we do through ICANN Connect on a very limited basis right now. Again, we may end up suspending those programs as well as more testing is done, as we get a better idea of how far this is spread in the community. We are talking with our providers in particular who are providing services on our behalf to make sure that they are using proper sanitization methods, and that if they are sick or been in contact with anybody who has been sick, to stop providing services immediately and to let us know so that we can let anybody they've been working with know as well. So far, everybody has been well, and that has gone well so far. We're crossing our fingers that they will stay well, but we are curtailing some of the new applicants into the program, and we're also curtailing some of the training, putting off some of the unnecessary immediate training, anything that involves necessary communication, that we're still providing that for those who need that. Our partners in device reuse, our biggest partner is Bridge Ministries, who operates the Meyer Mobility Centers in Seattle, and they are still accepting donations, but they've actually posted some guidelines on their website to let folks know, you know, what conditions they are having people come to visit and what conditions they're willing to accept equipment. Our state financing partner, the Northwest Access Fund, they are still doing providing services. They're doing almost all of that remotely right now. And that's partially because they actually had a staff person who was tested positive for the virus. So, so they are have a big impact for what they can do right now, but they're doing the best they can. Most interestingly, just as an aside, we've been receiving more requests for financial loans as of late that we have in current months. So it's sort of speeded up the need for financing for AT, which is interesting. With regards to our training and community outreach programs, we have canceled all of those through early April, and we will likely cancel most of the ones that we've scheduled for April as well. Again, that is out of guidance from the state. The prohibition now is any gatherings above 50 are not permitted, and so with that guidance and prohibition, we are canceling our events. And this is partially because in most instances, we are using someone else's facility, and we cannot guarantee that the standard of health and sanitization is being met. And so we just needed to keep that in mind when looking at those events, to make sure that we had the best interests of those who would have participated in mind. we have shifted some of these events to teleconferences and Zoom. We've only just begun doing that because as I said, it's only been a week. But we hope to have more of these offered towards the end of April and into May as a remote participation option. And we are also doing some of our demonstrations using Zoom, and we're doing some of our evaluations also using teleconferencing in Zoom. We're trying this out. We're seeing how it works. If we need to send equipment out, we will do so, but we will do so with, again, if the devices come back to us, we will treat it as if it had been in the hands of somebody who had an infection, and do proper sanitization when it comes back to us. Let's see. We've made sure that we've done proper communication, so we have some alerts on our website. We've done so on Facebook as well. I've reached out to our advisory council. They have an update about where we are with everything. I'm meeting with staff weekly now as a face-to-face to talk both about work and whatever else they want to talk about, just because I feel that social interaction is really important during this time. To keep those lines of communication open, and also just to get people, you have other ways of communicating, since most of my staff are stuck either in an office alone or in their homes by themselves or with family. So that's another option that we are doing. And as I mentioned earlier, I've been evaluating what tasks need to be done. We're looking a lot at our online resources, what updates we can do, what things we can do to enrich what we have online, what we can do for social media. So we started to look at scheduling posts for social media, things that could easily be done remotely, and that staff can do when other things can't be done because of the nature of the work that needs to be done. So so we're working on policies and procedures as well, updating those. And then as I mentioned before, I'm trying to be as flexible as possible with my staff, so that if they need to use appropriate sick or annual leave, they can do so to help meet those childcare needs that have come up. And I'm also being flexible with, as long as the tasks are getting done, I'm not going to be too concerned with them working the appropriate number of hours, just because we don't know how long this is going to be. Most projections I'm seeing are putting this not weeks, but months. And so if this is a long-term situation, we need to be really flexible and creative with how we help our staff, and also how we provide services. The last thing I just want to mention is that we are going to reevaluate our device lending in mid-April. Hopefully we'll have a better idea of how far the infections have really spread, and what precautions we need to continue to take. We may do some limited device lending at that point. Again, we will probably have any users attest that they have not been sick or been in contact with anybody who has been sick, and then take extra precautions when the equipment comes back to make sure that it's properly cleaned and sanitized. So that is everything for me. I will turn it over to, I think Carolyn is next.
Yes, and I just want to remind everybody, feel free to ask questions in the chat, and then once Carolyn is finished, we'll talk a little bit about questions, and we'll open it up. Go ahead, Carolyn.
Thank you so much. This is Carolyn, and hello, everybody. I hope all of you are safe, and been thinking of everybody across the country as we move through this collectively. Alan, I want to give a shout out to you because you have given great advice. You and I have had extensive conversations because we could see what was happening, and so thank you very much for being willing to show what's working and what's not working. And big shout out also to AT3 for being proactive and going ahead and having this important dialogue and conversation. So what I'm going to be talking with you about is looking specifically at COVID-19, coronavirus, the impact on reuse operations. Thank you to Trish Redmond and Liz Prasad. Trish pulled together some slides that I'm going to be working from. These slides are going to be available to all of you as a resource. And it's important that we're having this conversation. As y'all know, we've been talking about the importance when it comes around to reuse of not passing on anything but the equipment. For years, we've been talking about this since 2006. I really wish that all of our area agencies on aging and our independent living centers who are doing reuse were actually on this call with us, because I'm concerned about all of the reuse that's happening out there, and that may not be up to the same sanitization standards that we've been operating on for a long time. But some things for you to remember, and also some things to consider that are different than what we would have shared with you before when you're thinking about your operational impact and planning. Really, phase one preparation, phase two implementation. When we're talking about phase one, really you need to assess the supply of your personal protective equipment. We often call that PPE, so personal protective equipment for sanitization workers, and also assess the supplies for cleaning and sanitization, and really determine, do you have access to this? A lot of folks are talking about this throughout the country, that they can't find Clorox wipes anywhere. They can't find solutions for sanitization. Very, very important that you know if you have access to that. And there's a decision point at this, juncture. Do you continue? If you have those, yes, you continue with your reuse activities. If you don't, I would consider suspending your reuse activities, because what we have found out, and it's been several folks doing the test. One of the first things that I was paying attention to with our friends that are literally right down the street at the CDC, I was asking probably a month and a half ago, how long does this live on surfaces? Because that's the question we need answered when we're talking about reuse. And honestly, all kinds of questions they're asking also. NIH has given us some data about 24 hours on a cardboard box, about 24 hours perhaps on paper, 3 days, 2 to 3 days on plastic, 2 to 3 days on stainless steel. So those are important pieces for us to think about when we're talking about reuse. So decision point, do you continue or do you suspend your efforts? The next one, thinking about devising your plan for safe acceptance of donation. Decision, can you continue or should you suspend? If you can't do that in a safe and appropriate way, then perhaps it is time to suspend for a little bit and just make sure that you can move forward. And then also preparing communication so that you can train staff up and train your consumers up about operational changes. Some folks, what we're seeing is that they're changing the hours so that they can do a deeper clean of their reused equipment. In Georgia, we only have 2 reuse centers, Friends of Disabled Adults and Walton Options, that we work with. They both have systems in place, sanitization systems in place. They have triage in place, all of that. Phase 2, when we're talking about implementation, updating your donation and sanitization policies and procedures. If you don't have them, most of you do, but if you don't, or if your partners don't have them, I strongly encourage you to prepare interim policies and procedures and really start sharing those and posting them so people can see them right up front. I have done some surfing last night and on Saturday of some of your websites, and some of you actually have started posting that to ensure and reassure the community that you are indeed following procedures when it comes to cleaning and sanitization for your reuse programs. If you're not doing that, then please just be transparent about it and think about what you need to do. Really providing that quick refresher on training on existing or modified policies. Now's the time really to get everybody to either go through a quick training. We did a sanitization webinar, as many of you know, in November. I know some of you already told me that you have your whole team listening to that. So review that And then also update your continuity of operations plan. We call that the COOP, right? Specifically for COVID-19 circumstances. The game has changed. We have this scenario that we've been talking about for years. It's actually our reality now. So what we encourage you when you're thinking about phase one and that preparation, what you need to focus on is which activities do you have the resources to continue as usual? So are there specific items that you're reusing that are in high demand? Are there things that you're starting to get in, perhaps because somebody might have passed away, right? So thinking about what is it that you want to continue? What are your high demand items? Do you have what needs to be in place to make sure that it's sanitized and that you can get it up to working order and back out safely and appropriately? What must be modified or what must be suspended? And then also thinking about that communication plan, as I said. When we're talking about guidance around cleaning and sanitization, we have for years pointed you to, the CDC and also to JCO and several other partners. I would encourage you once again to go and look at the quality indicators that we developed with reuse, around reuse with AT3. And specifically, we point you then, but also it's been updated to the CDC COVID recommendations for household cleaning and disinfection. They actually have a whole site now where they're focused on the coronavirus and specifically looking at cleaning and disinfection. As I said, you can also check out the webinar that we did in 2019 in November. So paying attention to all of those things. When we're talking about also the assessment of reuse resources and looking at what kind of equipment do we need, that's a big question that you've been asking over the last 10 days. And honestly, N95 masks, that's very much what we're recommending now. You want to make sure that you have this higher end mask that does indeed help, and it's something that you would find in medical settings. You want to make sure you have those disposable gloves and that you're following the CDC guidelines of not touching your face. Also, if you sneeze, how to sneeze into your elbow, all of those things. Protective coverings for workers that are likely to have contact with contaminated devices is extremely important. So make sure that you have that. And I would encourage you to have this in abundance. Those 95 N95 masks can be used, again, if it's by the same individual and if it's not soiled. So keep that in mind. So you could label each of those for folks. You could put it in a plastic Ziploc bag. Those are some of the things that we want to make sure everybody's thinking about. It's also important that, and I've been to many of your reuse centers, that you, and most of you are in compliance with this, that you have access to water and a supply of soap and disposable towels, those types of things. Hand sanitizer, definitely, all of that needs to be available and readily accessed. When we're talking about looking at the supplies that you have on hand and thinking about, do you have adequate cleaners, you also want to make sure that you have enough chemicals and all of that for your hub scrub. Make sure that you have enough to clean your tools and your desks and your tables and handles and keyboards, phones, all of that. There's guidance that's available for each of these pieces. Also thinking about what the implications are, once again, at that decision point. There are some other key guidelines that we shared years ago, but they've come back around, obviously. There's List N from the CDC, and they have disinfectants for use against SARS and then also SARS-CoV-2. So I encourage you to find that and actually follow those guidelines. And once again, you'll have access to all of these details. We don't want you just to have this information and say, good luck. We want to make sure that you can actually get to the link, and you can thank, once again, you can thank Trish for that. We're encouraging folks as much as you can to move away from paper. As I said, there are some estimates that COVID-19 can live on paper for 24 hours. Some people have said it's only 3 hours. I got to tell you, if it's living on paper, I don't want to touch the paper. So maybe now is the time, if you haven't already, moving your work towards an electronic format and making sure that people have access that way. Also, thinking about the continuity of operations planning, just like Alan was saying, making sure that you keep your advisory council in the loop, that you know what are your hours going to be, that you have posted kind of what your plan is, and that you are ready to serve if you're ready to serve, and if you're not ready to serve, then figuring that piece out. I know Martha, Liz, and Trish and I have worked with many of you on those plans, and happy to talk with all of you about it again. The first time I think we started talking about that was in 2011. We have a webinar going all the way back, and I remember having some of those conversations in 2006. So thinking about the device donations, you might want to consider changing your practices around that, changing the hours perhaps to shorten the hours. Some people are even considering changing locations so that we're not having pickups at hospitals or drop-offs at hospitals, that perhaps it would be another partner that might be able to assist with this. Thinking about other stakeholders, and also thinking about, what does it look like when we maybe now's the time to partner with that supplier or vendor who might be able to help you in a bigger way with all of this. So know that as we're moving through this, we're learning a lot about how COVID-19 acts, how it's transferred. There are more questions than answers. And I think that's something we need to pay attention to. It does affect distribution in some ways that we have been thinking a lot about, and we want to make sure that we're still able to serve people, but it's safe and appropriate. A lot of you use methodologies where you triage equipment and then you move equipment through your process in a way that has already got this in mind. You were ready, you are ready, and that's great. And I think what we need to do is once again revisit that with the rest of our partners within the area agencies on aging and aging disability resource centers and the independent living centers. So feel free to point them to these resources. The only other thing I would say is I do encourage all of you, to kind of document what's working and what's not working. Feel free to send us that information. As I see it, and you've heard me say it before, that we're collectively brilliant, and a lot of that has to do with the way that we work within the ATAC community and really learning from each other. And we definitely want to learn what's working, what's not working. Several of you have sent included us in emails as you're updating your community. Please do that. That's incredibly helpful. So I hope this has been helpful, and I appreciate the conversation, and I'm going to turn it back over to Marty.
Great. Thank you so much, Carolyn and Alan. And I want to go on and kind of go through the questions that have been posed and then see if there are any other questions or things people want to talk about. I do want to mention that we do have a lot of subcontractors, I think, on the call too. We had sent out information about the webinar to the grantee list, but also to the AT3 list. And we noticed that there are an awful lot of people that aren't directly with the AT program, but are subcontractors. And I do want to mention that after the webinar, we are going to be sending out an email to all of the grantees to include questions about immediate changes in your programs, plan changes, what's happening, so we can better inform all of the other states and territories about what is happening in your state, to give you some more information, as much information as possible. Because as Carolyn mentioned, and we mentioned earlier, that things are changing from day to day and from hour to hour. So in terms of some of the questions that folks have been asking, wait for the slides to advance. 1 second. You know what, while we're doing that, can I get Amy, could you go ahead and go through some of the resources that are available on the AT3 list website?
Sure. Sure, I just need to find the exact links. So if you go to at3center.net and go to state initiatives and scroll down, you will see our link to emergency management. And the headline on that page, if you want to get there directly, it's at3center.net/repository/emergency management. The headline there is coronavirus pandemic. So what we've tried to do there is pull together a bunch of resources and annotate them slightly so that you may get a sense of what these resources are and whether you actually want to click through to it. So included in that list is the CDC link, specifically regarding, quote, high risk supplies to have on hand. And when I was thinking about our AT users, one of the supplies that people might want to make sure they have is hearing aid batteries. I know in many cases, people go through those like water. So be sure you're stocked up on those as well. And of course, the CDC website has many resources about symptoms, what to do, and preparing. We also provide the link to the ACL website, which will be continually updated throughout the course of the outbreak. Several other federal agencies have dedicated web pages, including the U.S. Department of Ed. And you might be in particular interested in the interim guidance related to services to young children and students with disabilities, the kids who are typically covered under IDEA. OSHA, the U.S. Department of Labor's Occupational Safety and Health Administration, has a document posted, Guidance on Preparing Workplaces. So, of course, health insurance coverage is a hot topic. So CMS, the Centers for Medicare and Medicaid Services, has some documents of interest. They have an FAQs on Medicaid and CHIP, Children's Health Insurance Program. One of the documents that's of particular interest is their document, Healthcare Providers Fact Sheet, that addresses a variety of requirements that are waived in this emergency, including waivers related to access to DME. So typically access to DME, you need face-to-face with a physician. That's just an example of one of the things that is waived. There's also a document on the CMS website that addresses Medicare Advantage, Part D, and the Medicare Medicaid plans. Also under that link, we have a variety of sanitization and cleaning, and perhaps we can also cross-reference this under reuse. So some of it is about cleaning bacteria, and of course, bacteria is different than the virus, but it's generally good cleaning and disinfection advice. And that AT3 archived webinar that we've mentioned before. One of the things that probably relates to all of us, not those who have pre-pandemic anxiety, is the idea of AT that might help with managing anxiety. And to this, we send you to the May 23rd, 2018 blog from the AT3 Center AT News and Tips blog for reminders. And the CDC also has useful information regarding managing stress and anxiety, and the link is provided for you. Yeah, I was listening to the Commonwealth of Pennsylvania update at 2 o'clock, and I was really pleased that our Pennsylvania Secretary of Health did manage mental health, did mention mental health issues. Other materials, those of you in the AAC world are familiar with the great work of Carol Zangari with her practicalaac.org. And she has curated some wonderful, wonderful resources, particularly good for families who might otherwise rely on schools for AT services for their children. So that website, Practical, it's with AAC in the middle, practicalaac.org, practicalaac.org. Great resources including social stories, visual supports for hand washing, visual schedules, all those low-tech aids that can be indispensable. There's also sample communication boards, symbols, and vocabulary. Thanks to those who are capturing what I'm saying and putting it in the chat. That is what we have. All of those links are listed on the at3center.net under emergency management. Marty, are you ready for me to hand it back to you?
Yes, can you hear me?
Okay.
Yes, and we do have all of the resources on the AT3 site at the end of this presentation, and we'll also send those out to the lists. In terms of some of the issues that people have talked about that we're monitoring on the chat, there are several people that have discontinued their device lending program. One of the things we wanted to do was just to see right now if anybody has any specific questions for any of the panelists or for any of the other state programs.
So this is Amy Goldman again. I just wanted to mention that as I find resources every day, I do post those on the AT3 Facebook page. And then hopefully once a week, I will add those into the website. So again, like us, follow us on Facebook for up-to-date. Feel free to, of course, share anything that is on the AT3 Facebook page. And those of you who have Facebook pages and I follow you, if you find something, post it and I'll repost it or share it.
One of the questions that Laura Gearhart had asked about if we received any questions or requests to assist teachers and children with IEPs while using long distance learning. And I think that kind of just relates to the idea of device demonstrations in terms of using your distance device demonstrations as opposed to in person.
So Marty, this is Amy, if I may interject. This is a great opportunity, you know, inside every tragedy or emergency, we can find an opportunity to raise some awareness about accessibility as it pertains to ICT, inclusive, of course, of distance learning. So this is a great opportunity to reach out to people, and hopefully we will, AT3 will be sending along some resources to you in the ICT community of practice.
Janice Carson in Idaho says, yes, they're developing some materials. And Lori Brooks mentions in Oregon that they have some requests from adult children who have parents in facilities and they wish to borrow iDevices that they can FaceTime with their loved ones. Does anybody have any thoughts or anything going in that area? And by the way, we'll send these questions out and then also follow up after the webinar too.
This is Alan. There was a question about what schools are doing with regards to special education. The superintendent of public instruction for Washington has published quite a bit of information, including some FAQs about how those services are being provided now that schools have been closed. I'd be happy to send those out to the group if people are interested. We don't work directly with schools as there's a state-funded special ed technology center, and so they've been really great about sending out information to the community about special ed and making sure that accommodations are happening if there's any distance instruction happening for their schools. And just as an aside, in Washington State, some schools are doing some distance instruction. It depends on which grade the students are in. And in some cases, the schools are providing the tablets or laptops for the students to use at home. I'm not sure what's happening in the districts that can't do that. So those are the sorts of things that are currently being looked at in Washington State and are presenting a challenge.
So this is Amy. Lori asks, are any of the programs receiving requests from AAA's, ADRCs, or Centers for Independent Living?
This is Carolyn, and yes, we are receiving requests, and they're limited right now, but we are receiving those, and I would expect that to continue to grow because some of them are actually having similar issues. We do have a meeting planned, and I appreciate how responsive our Division of Aging Services has been. So we do have a meeting planned specifically to talk about all of this with them here in Georgia.
Yeah, and Laura asked me to repeat, this is a question from Lori Gerhard from ACL about whether or not any of the AT programs have received requests or requests for information from the ADRCs or the area agencies on aging or the centers for independent living.
This is Alan. In Washington, we have not. I think partially because it's been happening so fast, it's felt like a water hose. So very few organizations are, I think everybody is pretty much trying to figure out what to do in-house. So there's not been a lot of reaching out as of yet. And part of the issue is a lot of the offices just closed recently. Many of the senior centers were offering services as of the middle of last week. Now almost all, in fact, I believe all of those have now closed. And they are offering some services where staff are going to individuals' homes to provide needed services. But other than that, senior centers are closed. And many of the offices that are supporting seniors and persons with disabilities have at least closed in the sense that the staff aren't receiving clients, but I know that they're at least doing some telework and some distance work with their populations.
This is Carolyn. I would also add that we're having a significant increase in requests for post-secondary and quite a few issues around accessibility, and then also true inclusion as people move to distance learning. So lots of issues around all of that.
This is Amy. I'm just wondering if any of you are having difficulty accommodating your own staff with distance telework, or whether you're hearing from others who are having difficulty being accommodated when there's a requirement to distance work, telework.
And this is Alan. One thing that I know that a number of organizations in Washington are having a problem with are phones. In many instances, people don't have cell phones for work, and or they don't have a way of getting their office phones to ring to remote numbers in a way that allows you to also call out looking like an office number rather than your own personal number. So that's like the biggest challenge I know of organizations in Washington having to face. In our program, we have 2 office phones that we will be using when staff need to work remotely. We're looking into having our 800 number at least ring to those cell phones, but what we're able to do, and I know this isn't the ability of everybody to have this feature, but we can have our voicemail go to email, and so we can actually see the messages that way, and then we can respond either using an office phone or email to make those connections. But that's one big thing that we've heard about, at least in Washington.
And a couple of people have said that that a lot of their subcontractors are centers for independent living, and so obviously they're working with them and trying to determine ways to serve everybody remotely, or what the options might be. But I think a lot of states are just going through that now, since things have even changed within the last 2 days. And I wanted to point out, just on the resources list, of course, the Administration for Community Living has a great website on the COVID-19 virus. It really covers a lot of different areas. So that's one resource that I would certainly take a look at. And can you advance to the next slide? And then some of the resources that Amy was talking about on the AT3 site, in the emergency section on the AT3 website, under emergency management page, there's a link specifically on the corona pandemic, and it goes to a lot of different resources that Amy talked about and some others. And then she mentioned the AT3 Center Facebook page. It is continuously updated. There's a lot of different resources that are posted on the Facebook page. And then if you're subscribed to the AT3 Center news and tips blog, a lot of the things that you'll see on the Facebook page are also posted on the AT3 Center news and tips. And this webinar will be posted on the AT3 Center website, and we also send out a part of the links on our list, on the grantee list, and also on the AT3 list. And some resources, Mike Rada posted a couple resources. We will post those when we send them out. Sandy McNally in Pennsylvania was asking if anybody was having a problem with parts of their states not believing that there is a problem.
This is Alan in Washington. The main reason the governor decided to close all restaurants and bars was because there were lots of pictures getting posted on social media of crowded bars and restaurants in neighborhoods of Seattle. And so it was an instance of the younger population feeling they didn't need to take precautions and not realizing that they could be potential carriers. That's, again, it's one of the big issues is that everybody needs to understand that, you know, you are potentially a carrier. You don't know who you've been in contact with, who's been in contact with somebody else, so forth and so on. So everybody needs to act appropriately and practice good social distancing, working remotely, and reducing your contact with others as much as possible.
And Rob Gronendahl has just posted a resource, Corona's tips for dementia caregivers. And again, we'll be sharing all of these websites and links. And like I mentioned, we will be sending out some questions about to find out where grantees are at, what other questions they might have, what immediate changes that they're going through, what plan changes might be happening down the road, because again, things are changing quickly. So what's true today might not be true tomorrow.
And this is Alan. I would just say that if you're not seeing the types of things we're talking about as far as reduction of public gatherings, closures of schools, etc., I strongly suggest that you act as if that's going to happen, because the likelihood of that happening nationwide is pretty high. And you have time to make some preparations, and I would take them right now rather than waiting until it happens.
Yeah, that's 100% true, Ellen. What's happened in one state might not happen to another state until the next day, or another city until tomorrow. So, but the likelihood is that it will happen. So is there anything else that any of the panelists would like to add? I want to thank you. Go ahead.
This is Carolyn. I was just going to say, I am very interested, and we absolutely will keep our eye on how things evolve with getting more data and information about how long this virus and other ones live on surfaces, and we'll keep everybody posted on that. So yeah, And as I said, if everybody could just keep us in the loop, this has been extremely helpful. Thank you all.
And again, we'll be in contact with everybody, and this will be an ongoing effort in terms of people keeping each other informed and all the state and territories working with each other to make sure we have the latest information, and also to find out what kinds of solutions that people are crafting and as things move along. So thank you everybody for participating, and we look forward to talking with you again soon.
Stay well, flatten the curve.